All right. Hello, everybody. Dr. Koch here with my very special guest. Hi. Asher. Okay. This is my son, Asher, and I thought I would give you a little glimpse into our world because right now in our class we are studying neurological disorders that you will see in the classroom. And the chapter focuses, this is for TESE 437, the chapter focuses on the three most common neurological disorders that you'll have within your classroom, which are headaches, epilepsy, and Tourette syndrome. So I happen to be the mama of a kiddo with one of these disorders, and that is epilepsy. So I brought the fabulous Asher on here because he is such a rock star, and he is wonderful about allowing everybody a little bit of an inside glimpse into our world. So we decided to do it from right here because this is our world right now. So with this pandemic, we have to be a little bit more careful with Asher. And I'm just going to let him talk a little bit about what he has and how he has gotten better and all that stuff. So Asher, what do you have?
Epilepsy.
You have epilepsy. And how about, how many tonic-clonic seizures have you had?
One.
Only one. That is very key for Asher. So Asher does have epilepsy. A tonic-clonic seizure was formerly known as a grand mal seizure. And Asher had one right when he was diagnosed with epilepsy. It was, he was going to bed one night, and he came into our room and said he was scared, and he just hit the ground and started shaking, convulsing, and vomiting. Honestly, as somebody who's trained in seizures and in epilepsy, it took me a solid 30 to 45 seconds to figure out what was happening with my child, because there's a big difference between being a professional and being a mama. It was, to this day, the scariest day of my life, but very, very, very fortunately, Asher came out of his seizure rather quickly. It only lasted about a minute, which was amazing. And the next day, we took him to the ER that night. The next day, they had him in doing all of these testings. And what's the big test that they do that you just love? An EEG. And what do they do with you?
They put like sticky stuff in your hair and all these wires, like 20, 30 wires in your hair.
It's a lot of wires. It's a lot, isn't it? Mm-hmm. Asher doesn't love that, but he definitely understands why he does that. Because what does it tell us?
It tells like when I had one and like how long ago it was.
It does. It can tell, if he's recently had seizures, if he's about to have a seizure. It reads those brainwaves. And that is how Asher was diagnosed with epilepsy, because that key time point after he's had a seizure, in order to get an accurate read is crucial. So fortunately, they got him in right away after that first tonic-clonic episode, and Asher was diagnosed with generalized epilepsy. So there are some things that are different for our family because of Asher's epilepsy. However, we look at them as blessings as opposed to as problems, because there are a lot of really positive things that have come out of this. So one of the most important things is that Asher is on a medication called... You are on that. That's for your anxiety that comes along very often as a side effect of epilepsy, is that anxiety, because there's kind of this fear that naturally comes from the not knowing whether or not you're going to have a seizure or not, and what's going to happen as a result of it. So Asher's on an anti-anxiety medication to help with that, and the anti-seizure med is Keppra. And how big are your pills?
A horse pill.
It's like a horse pill. He's not joking. So Asher takes a giant pill. It's seriously like the size of the tip of my index finger here. And he is a rock star. He takes 1.5 Keppra pills every day. And it is important that he takes them around 12 hours apart, because that Keppra level has to be at a certain level within his blood. And that's where life gets a little bit tricky for us right now. My computer just went to sleep. Apparently it's bored of us. Okay. So, Asher, last year you got sick, and it was just a stomach bug. And what happened after you got sick last year? Well, that's good. It's good that he doesn't remember that, because we started seeing some more seizures, didn't we? Okay. You remember that?
Apparently.
No. He also doesn't remember the seizures, which is good. we love that about epilepsy. He doesn't remember the episodes, which is nice. They don't hurt. That's very, very important. Do they hurt? No, they do not hurt at all. The danger with epilepsy is a child going into an epileptic seizure and falling, hurting his or her head, having some sort of an injury because of it. But we're very fortunate that all of Asher's seizures have been nocturnal or when he's really tired. So very fortunate on that end. Now, he doesn't remember the seizures, which is great. None of them were tonic-clonic. None of them were grand mal. We just see more, they're called absence seizures. We used to call you the space cadet, didn't we?
You did.
We thought Asher, he's questioning me. You don't remember that. Well, when he was younger, before we realized that Asher had epilepsy, we used to call him our space cadet because he would just like stop and stare and like zone out for a while. Do you remember that now? Well, you don't remember the episodes. Anyway, he would just stop and stare and just zone out for a little while, and we'd be like, Asher, hello, come back. And, you know, hindsight 2020, Asher was having seizures. They're called absent seizures. And his usually only last about 10 seconds or so when he has those. But we definitely started seeing more absent seizures, which for us, it's nice that we can get kind of that indicator of those absent seizures. Hang on. We can get kind of that indicator of those absent seizures, and we're recording, bud.
For what?
Never mind. And hopefully be on top of it before we have any grand mal seizures. Because if we are seeing some absent seizures, then it is very possible that Asher needs a Keppra, which is his anti-seizure medication adjustment. So we might need to go up on the Keppra level in order to make sure that that's accurate within his blood. But that being said, being sick can be a tough situation for Asher because, buddy, what happens if you get sick?
Seizure get higher.
Yeah. Okay. Chances of having a seizure increase because of that sickness changing different levels within his blood. The last time that he got one, it was just because he got sick, like kind of like a stomach bug. Even just a cold can do it because the potassium levels in his blood can get thrown off. His potassium was really low because he was sick, and it threw off his Keppra level, and he had seizures. So we have to be a little bit more careful on that. Now, does this mean that Asher should be like completely not allowed to do anything? Absolutely not. I mean, we take our chances at certain spots. However, right now we're in a pandemic, and that's why we have chosen to show you what our world is right now, because we are homeschooling Asher. The main reason that we're homeschooling Asher is because we don't know a whole lot about this pandemic, and there's not a whole lot of research, but the research is showing for the people who have epilepsy. Quit it, Hudson. The research is showing that it is something that definitely can cause an increase in seizure activity. If Asher has a seizure, the clock resets on the different restrictions that he has. So right now he's gone almost a year free of seizures, like 7 or 8 months. So I guess half a year, free of any seizure activity. If he stays on this track, then when he gets older, Asher will be able to do all of those things that other teenagers get to do, like have a driver's license, like be able to, go and do these activities, because the hope is that he is actually growing out of the epilepsy. And we pray that that's the case. And in order to try and kind of make things a little easier on him, we are homeschooling right now so that he doesn't have those seizures, and it allows his brain to to adjust, to heal, to continue growing without adding in the pressure of sickness and seizures and things along those lines. So that's just a little bit of a view into our world behind the scenes with epilepsy. You can see Asher is just thrilled with with all of this. But, buddy, is epilepsy that big of a deal?
No.
Surely not. You do just fine, right?
Mm-hmm.
Does it affect how well you learn?
No.
Nope, it does not. It's just a thing. It's just a thing that we deal with, and we've chosen to homeschool in order to give Asher the best chance at healing right now. And so, welcome to our world. This is where we are. So, thank you, buddy.
Mm-hmm.
You're awesome. I love you and goodbye.